超过100万像您这样的纽约居民信赖第一保健，我们满足您的医疗保险需求。第一保健提供您人生每一阶段符合您预算的计划选择，请今天就询问并了解更多资讯。
Hello， 观众朋友们，大家好，欢迎您收看今天的健康1+1，我是主持人啾啾。其实啊，呼呼大睡呢是用来形容人睡觉的状态，会觉得好像打呼就是睡得很好，其实不然哦。打鼾声呢，可能就是我们呼吸发生问题的一种信号。那在台湾呢，有做过一个调查，15岁到70岁的人呢，50%以上的人都会打鼾，但是呢，有5%的人可能产生呼吸暂时停止的一个现象。那这个在医学上称之为阻塞性的呼吸。睡眠呼吸终止症。因此呢，我们今天要来跟观众朋友们一起来探讨这个议题。那我们今天要邀请到2位的特别来宾呢。第一位来宾呢是Dr. In， 他是睡眠以及牙齿专科的医师。Dr. In，Hello， 欢迎 ，Welcome。
Hi, thank you. Hi, my name is Dr. Lily Ng.
第二位呢，我们要欢迎到他其实是Dr. In 的第一位病患哦，他是 Mr. Magnan。Welcome.
Thank you. Good morning. Thank you very much.
Hi, Dr. In. Many people think snoring only affects your sleep quality. It is not a serious problem. Do you agree or not?
Absolutely not. Yes, snoring does affect sleep quality as well as the sleep quality of other people nearby.
Yeah.
But the snoring is just an indication of a condition that will actually lead to other future health ill effects, conditions, and diseases. There's definitely damage because, first of all, when a person snores, it means that there's airflow restriction to breathing. So generally in this case it's through the throat. So air is not going through that well. And during sleep, when the body is at rest, all the muscles are relaxed. So the entryway to the throat, there's soft tissues. Let's call them curtains or blinds, like to a window. So when it's relaxed at night, it's floppy and it's loose. And when air is trying to go through, if the flappiness is very loose, then sometimes the flappiness just closes up the opening to the throat.
Yes.
And when that happens, a person can't stop breathing. And when they stop breathing, then there's lack of oxygen. It will also interrupt the sleep from deep sleep into light sleep. So that's the sleep part of it that's affected. But then after that, then the brain wakes up a little and says, well, we need to survive, we need air.
Yes.
So then the heart starts to race. So when the heart is supposed to be resting during sleep, it doesn't rest.
Yes.
And then the blood pressure goes up.
Yeah.
And we know that when there's high blood pressure, it causes lots of other conditions like cardiovascular disease, meaning like heart disease, disease of the blood vessels, and also to the brain, which can lead to strokes. And I mentioned the heart attacks. So when all that is affected, then the person's health continues to worsen, and then it can lead to diabetes. The symptoms that a lot of patients experience from, first of all, the poor quality sleep, and also the actual metabolic effects from the lack of oxygen in the body and the inflammation in the body from the lack of oxygen, is that they can get headaches, definitely headaches.
Really?
Yes, headaches and lack of concentration. Of course, excessive daytime sleepiness.
Yes.
They need to take naps. Or they feel that they had a lot of sleep, but then they just don't feel well. For children, they get hyperactivity disorder, ADHD. Oftentimes for adults, they just get sluggish. They can't stay awake. But kids, they get hyperactive.
Yes.
And that's an epidemic now too with children. And a lot of it is also because of this breathing issue during nighttime.
I see. So this is a very big problem, right?
Yes.
So do you have any medical treatment for the snoring problem? And
yeah, there are 4 ways to treat this. First is lifestyle change. Such as weight
Change
loss.
Lives.
Yeah,
It's
difficult, but
Typical.
the reason why there's an increased number of people snoring and having sleep apnea is because the obesity rate has gone up.
Yeah.
Just a lot of people are getting heavier and heavier.
Yeah.
And it has to do with their lifestyle. I mean, it's difficult now because there's so many food choices out there that leads to a person to gain weight. So it's that, that's one way to actually help decrease the problem because it creates more open airway space when there's less fat around the neck. That's one way. It's difficult. I mean, they could use medications for that, if they really need help with that, other than just exercise. Secondly, if the person is diagnosed with sleep apnea by a sleep physician, meaning that it's not just snoring, they actually stop breathing many times, they can use a CPAP machine, which is called continuous positive airway pressure. So it's a mask, it forces air. For a lot of people, especially when they're very severe, they stop breathing many times during sleep, that's the one way to treat it. But there is an inconvenience to that.
Yeah, how can we know we stop breathing at nighttime? How can we know it?
Well, it could be observed from a partner, a sleeping partner, a family member. You watch the person, they're snoring, and then suddenly they hold their breath for a while.
Yes.
And they exhale and then they can't breathe back in because then suddenly the soft tissue in the throat just collapsed or closed up because it's long and floppy, and then and also tongue can pull back and the air tries to go in and it can't.
Yes.
So it's a temporary stoppage. So when that happens, sometimes it's observed. That's when you know the person definitely has a problem. But some people may not know about that. They probably just only know about the loud snoring. Then one way to find out for sure if they have a severe sleep apnea problem is go to see a sleep doctor who will give them a sleep test, which means there's two ways to do it. Either they sleep at the sleep lab overnight, or they can have a take-home unit. It's called home sleep test, a very portable, small unit, which is what's more commonly used now. Take it home to sleep in their own comfortable bed.
Every day?
No, just one
Carry?
night. Yeah, just one night, just to
night.
find out, to record the sleep, to record the oxygen level,
Okay.
and then to find out if they actually do have a sleep disorder. It's called sleep breathing disorder.
Okay.
And the sleep doctor can read that and give them the report. And once it's established that they do, then it's this CPAP I just told you about, that mask to force air is one way. But a lot of people don't like that because it's, first of all, it's forced air. They may be limited to moving side to side when they lie down. It has to be plugged into electricity, so if they want to take trips, fly around, it's inconvenient to lug it, and sometimes if they go to a remote place, they can't use it where there's no electricity. Because I remember I had a patient who wanted to go to the Amazon, and he was okay with a CPAP machine, but he couldn't use it at the Amazon for his long 1 month trip. He needed treatment, otherwise he could die. So then he came to me and he made another type of device that did not require electricity, which is what brings me to what I do. Oral appliance is a special night guard. It's something you put on the teeth, top and bottom, and it keeps the jaw open and it keeps the airflow going. So the convenience with that is that it's portable. It's no electricity. The only disadvantage is that some people may not be able to tolerate putting something in their mouth, but usually they get used to it with practice and time. They get used to that, and those are the main disadvantages. The fourth way is surgery.
Surgery?
Yeah, so it's very invasive. So that's usually the last resort. There are different types of surgery. Some are just mild or very little as far as like removing excess tissue in the back of the throat. It may or may not work. There's no guarantee
It
with
sounds
that.
a little bit dangerous.
Yeah, there's definitely some risk involved with that because there's some cutting. Sometimes it's used, there's another new way called radio frequency ablation. No cutting, but there's still some risk involved and there's some pain, of course. The one way that could definitely work for most people, I think it's about 90% success rate, is where it's a maxillofacial surgery where they actually have to section off the bone, the jawbone on the top and the bottom to stretch out the face, so then that way the airway is more open.
So what is your recommend for the treatment? What kind?
Well, other than the easiest way, lifestyle changes, because there's some people who may not be obese either. They could be thin. There's some thin people who snore very loud and they may have sleep apnea. In that case, I would recommend a simple device, the one that I like to make, which is a dental oral appliance. It's something that you put in the mouth. I take some measurements first to find out what is best position to help open up the airway space, the opening to the throat for free breathing.
Do you have the snoring problem in your story?
Yes, I do. My journey to recovery started about 7 years ago. I noticed that I was snoring extremely loud at night. My sleeping partner, she told me that your sleeping is interrupted. I would gasp for air, like Dr. Ng was explaining earlier. And my sleep was interrupted all night long. I would stop breathing, gasp, wake up, snore, and I noticed in the mornings I would wake up with headaches. And I said, why do I have these every single morning? Headaches, and the back of my throat was sore, and I just didn't feel rested at all. And that's no way to wake up every single day after sleeping 7 hours.
7 hours, still feel so tired.
Yes. And I was reading, and it says, all the documents say to try to get 7 to 8 hours of sleep, which I was doing, and I still felt unrested every morning. So I went to a sleep study at NYU. It's an overnight study. You sleep within their facility, and they monitor all your, I guess, your heart rate, your brain waves. They hook you up to many wires, and they study you all night long. There's a camera, and it watches you sleep, your pattern of movement, and how you snore. So they told me, Dominic, you have mild sleep apnea. There are evidently different degrees of sleep apnea. So mine being mild, they said, why don't you try a sleep device, an oral piece? And that's what led me to Dr. Ng. I found her that she was creating these oral devices, and I was her first patient. So after that, I started using this device, and surely enough, I said, wow, I'm feeling much better. I'm sleeping better, my concentration was better.
First time when you use it, you feel better?
It took about 2 weeks to get accustomed, a week and a half to get accustomed to having something in my mouth, but I also noticed after 3 days I was sleeping better. I woke up feeling fantastic, better rested, and it made me want to continue to use this oral device. And that was 7 years ago, and I still wear it today, and I feel much better. Yes, my blood pressure, I didn't mention, was elevated at the time because I was snoring, and now my blood pressure is back to its normal rate.
Wow.
So this oral device has helped me tremendously.
Do you feel uncomfortable?
I'm used to it. In the very beginning, it took a week or two to get used to having something in my mouth that's a little. What it does is it projects your bottom jaw forward a couple of millimeters. So you're sleeping with somewhat of an overbite, right, doctor? Is that what they would call it?
Underbite.
Underbite. You sleep with an underbite.
Yes.
And that in and of itself, it takes a while to get used to sleeping in that position. And that's what creates the opening in the back of your airway by having your bottom jaw forward, allowing the air to go through freely. But it's well worth it. For me, it saved me.
And Dr. Ng, please tell us your principle, the treatment principle.
But in any case, how it works is very simple principle. The device connects to the top teeth and the bottom teeth, the two jaws together, and I just position it where the lower jaw projects a little bit, where it sticks out a little bit. It may not have to be very much, just enough. I take measurements, so it just has to be enough that the person can breathe freely without the snoring issue and without the collapsing of the soft tissues in the back. So that takes a few steps, but basically it's all about just bringing the lower jaw slightly forward. And we could try it in the daytime too. We could check.
Really?
As far as, just as a test, see if we could snore in our normal position. Like I can just fake a snore, breathing in through the back of my throat. If I stick my jaw out, I can't get the back of the tissue to vibrate.
So it's very simple, right?
It is.
It's a very simple concept.
Yeah.
And it works, and it avoids all the surgeries and the drama that can come from all that.
Yeah, so you must feel so happy, right, Mr.
Yes.
Magdalene?
I look forward to putting that piece in every night.
Really?
I do.
And I think your partner also feels so happy about this.
Yes.
Hey, Dr. Ings, can you share with us how this device works?
Sure. Okay, this is one brand that I like to use. It's custom made. This is made by SoundMed company. I take models or impressions of the patient's teeth, and the lab actually help fabricates it with the measurements I give them. And basically, it looks like this. This is the top jaw, and this is the bottom jaw. And the patient would put it on one at a time, one on the top, and then on the bottom, like this. Snap it into, and so it'll fit the teeth. And then when the patient closes the mouth, the bottom piece just hits against this part. And this part is fully adjustable because based on my measurements from where I think it may work, the patient may or may not feel comfortable.
Yes.
Okay. I try to make it as comfortable as possible. If it's not, this part can be adjusted. So it means it will either bring the lower jaw a little bit more forward or back. And if it's not working well enough, we can adjust it also to get it to a position where it's effective. And how can I determine that? I mean, snoring is one way to determine that, but the final way is to have another sleep study. And sometimes it may be inconvenient for the patient to go to the actual sleep center and be monitored overnight and be watched overnight. The other way is to do a portable sleep test at home. Small little unit, just put it on themselves and just sleep at night. And the recording will be given to the sleep doctor who will make the final reading of whether or not this is effective.
Wow.
So this is the custom way.
First one?
Yeah, this is just one brand. I mean, I work with other brands too. It depends on the patient's mouth, what's most appropriate for them, what's most comfortable. So it depends on the shape of the teeth, the shape of their mouth, if they have a larger mouth, smaller mouth. So all those are factors that are considered before I decide which type of model to give them. I just want to show that they're also non-custom appliances. Sometimes I may want to find out if bringing their jaw forward is even effective for them.
Oh, really?
Okay.
For everyone?
Yeah, for those who are good candidates for having a mouthpiece. Because I usually treat patients who are mild to moderate with their sleep apnea. The severe ones usually try CPAP first. But if they cannot tolerate the CPAP, it's too uncomfortable, then they also come to me. Or the sleep physician will refer that patient to me. And then I would make them appliance. But sometimes if I feel that if they already have pain in their jaws, because some patients have that, I might want to just try a simple non-custom device first, just to move their jaw slightly forward and see if it will actually help them before we decide to make them a custom model. So this one here, we'll put in hot water.
I'll put in hot
water. And this is like a rubber, it's called thermoplastic material. It's rubbery and it gets soft when you make it hot. And then after a minute in the hot water, put it in the mouth, right down. The teeth marks go in there, and then and that's it. And then this is somewhat adjustable too. So there's like 3 positions I can put in here.
Oh,
and we try it out.
Hey, Mr. Magdalene, would you like to show us your dental device?
It's 2 pieces.
Yes.
One's for the bottom jaw, one's for the upper jaw. And these are the screws that Dr. Ink said that you can adjust to make the bite pushed forward or backwards.
Yeah, put it on. Oh,
And we put the lower one in.
Can you still speak?
Yes,
Oh,
you
cool.
can speak. Absolutely.
Do you feel inconvenient?
A little cumbersome, but I'm used to it.
So so
And that's it. And now my bottom jaw,
yeah, a little bit higher.
a little forward,
If forward.
slightly. And that's it. It's very comfortable.
This dental device is really helpful. How often do you need to change it?
You don't have to change it.
Do you have to change it?
Do not have to change it as long as it works. But of course, over time there's wear and tear. Maybe about 3-4 years later, sometimes if there's a little crack, you may have to change it. But I've had patients I've worn it for over 6 or 7 years, and there's no issue. So as long as you take care of it, you don't drop it every day, then it generally lasts.
Wow.
You have to be careful not to drop it and keep it away from the animals. I had
Did you have
I had
this
a dog.
experience?
Yes, I came home and the dog was chewing on it.
Oh yeah, I remember
And
that.
I went to the doctor
Your
to
dog?
make another one.
Yes.
How to clean it actually?
Clean it every night with a toothbrush. Every morning when I
toothbrush?
wake up. Yep.
Oh, it's
You
very
could even
easy,
put a little
right?
toothpaste if you want. Yeah, you have to keep it clean.
I think this treatment really benefit to so many patients.
Dr. Ying, do you know we interview a couple? Let's take a look what they saying.
Michael 和 Elaine 是一对夫妻，晚上睡觉时，先生打呼很大聲，妻子會磨牙，對生活造成困擾，直到他們找到了醫生。
之前就以為咧，或者係有時工作個時間比較長，咁咧就睡眠不足。咁我就有一日咧就去好多個醫生嗰度去睇，咁啊醫生咧就話我一切都係比較正常嘅，咁我就揾唔到原因點解我成日都會每個禮拜有3、4次係好即係好頭痛咁樣。咁啊自從到我遇到 Dr. Ng， 咁啊 Dr. Ng 咧就同我介紹去做一個 sleep study。
晚上你要到那儿过一晚上，它就是在你的头上啊，全部都插满了那个 sensor， 就是像那种仪器啊，看那个电波的这些纹路，它就整个晚上都有人观察那个电脑，它那正幅度的不一样，它会告诉你你在哪个 level。晚上它是拿一个机器，它是就是撑开的，撑开你的嘴，就你的嘴不能完全的关闭，你要这样。但你睡觉以后，你就没有办法再张开你的嘴。这个机器呢，就帮你把这个空氣啊，更多的氧氣吸進去，足夠的氧氣你就不累嘛。
我開始嗰陣時候咧，我有啲唔係好習慣，但係一戴上嗰陣時候，第2晚咧唔可以講一個奇蹟，但係可以覺得好有大個幫助。我一起身就冇覺得好攰，冇覺得疲勞，心臟又冇痛，咁咧就又係冇頭痛添。
自從戴了這個儀器以後，他自己精神面貌也很好，所以周末的時候我們也會帶孩子出去玩呀，也不見到他說累了。
有幾次咧，我落班翻到屋企夜，有時咧我就真係唔記得戴，因為唔戴嗰陣時候咧，第2日咧好明顯會覺得呢度個頭部咧就開始痛，又覺得心就雖然冇痛，但係咧都係有覺得好似好重咁樣個感覺。咁咧就覺得自己好攰，咁我就知道因為我唔記得帶嗰個 sleep device， 所以咧我依家咧 every day 我都一定要記住，一定要帶。
只要有打鼾的問題，無論是男女老少，這個不分年齡，我覺得您應該及時的跟你的醫生就是說一下諮詢我這個打鼾到底是不是問題。打鼾其實現在科技發達，它是一種病。它不是正常的，而且它影響你很多方面。
This is a very nice story. Any more story can you share with us?
I had a patient who was an athlete.
Athlete?
Athlete, yes. He was in the triathlon and Ironman type of competitions. And he came to me, he said he snored and he had a sleep study and it showed that he was very mild. Mild is in the range of, let's say, 5 times to 15 times per hour. That a person stops breathing for about 10 seconds and the oxygen level drops. He was about 5 or 4. He was almost at the normal range. And he told me that his heart rate was, he could never get it down below about 75. For an athlete, that's very high at rest. So we decided to make the appliance anyway because we thought, well, you know, maybe he's just tired for other reasons. So he had the appliance. The next day, he told me he finally felt refreshed. And his heart rate wasn't as low yet, but after a few more weeks, his heart rate went back down to where the athlete, or where is an expected level for an athlete,
Fantastic.
about 60.
Yes.
And he has to wear it, and now he's performing way better, you know, in his sports. And then also he's gone to business school at Stanford to get his MBA, so now he can focus a lot better too.
Wow. 今天真的非常高兴呢 ，Dr. Ying 跟我们的Mr. Markland 来到我们的节目中。我相信呢，如果您家里真的有这个打鼾的问题哦， 不要觉得他根本不是什么问题，不是什么身体上的问题，就不理他。所以如果你有这方面的问题呢，不妨就找你的睡眠医生或找Dr. In这样的医生呢，来帮助您解决您生活上的问题。那新唐人电视台呢，跟大纪元时报为了更好的服务我们华人的朋友，所以设立的一个北美寻医热线，只要您拨打855-668-5066，只要一通电话就可以让您找对医生看这科。希望你会喜欢我们今天的节目，我们下期节目再见。
超过100万像您这样的纽约居民信赖第一保健，我们满足您的医疗保险需求。第一保健提供您人生每一阶段符合您预算的计划选择，请今天就询问并了解更多资讯。